Hello everyone, this is Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. Today we are going to discuss about cancer imaging and treatment. Okay, what is cancer? See here, normal cells versus cancer cells. First one, it represents normal cell. Second one is hyperplasia. Third one is dysplasia. And the final one is cancer. Actually, normal cell is highly different from cancer cell. The first one is our normal cell and the last one is our cancer cell. Okay, what do you mean by this benign and malignant? Benign is beginning and malignant is a critical form. Benign, it doesn't have any cancer cells, non-cancerous, do not grow into other tissue. Malignant, it is cancerous and it invade tissue or it can spread. See here I have listed different kinds of cancer and how are cancers named here. Please go through it and see here the invasion and metastasis. See the primary cancer and see here the primary cancer cells flow into the blood and cancer cells in the lymph system and metastatic tumor. See here primary cancer, lung metastasis, and in this metastasis cancer spreads to the other parts of the body and finally it goes into brain. What are factors may increase the risk of cancer? It may include tobacco, diet, alcohol, physical activity, obesity, all the above. Okay. While coming into cancer prevention, Americans can prevent 1/3 of the most common cancers because they are staying lean, eating smart and moving more. And while coming into this cancer risk factors, some infections are immunosuppressive medicine, radiation, inherited genes, we have considered the cancer risk factors. See, in cancer prevention, although there is no way to completely prevent a diagnosis of cancer, health behavior can reduce the risk of cancer. See here, I have listed some of the health behaviors. Avoid tobacco, please limit alcohol, avoid excessive sun exposure, avoid cancer viruses, avoid exposure to carcinogens at work, and we have to consume more fruits and vegetables, exercise regularly, get screening tests, go to checkups regularly. Okay, while coming into cancer detection and diagnosis, cancer can be diagnosed with biopsies, blood test, urine test, and we can have so many tests to test the cancer detection and diagnosis. When a cancer is found, a doctor will determine what type it is and how fast it is growing. In some cases, finding cancer early may decrease a person's risk of dying from the cancer. For this reason, improving our methods for early detection of currently a high priority. Okay. See here the example for lung cancer screening. Here we have diaphragms, lungs, nose, mouth, and we have to screen the lung cancer. Here we have an example. See here, a normal connective tissue and cancerous connective tissue. See the difference with normal and abnormal tissues. And we have to monitor and we have to calculate the cancer staging. It is used to help care providers exchange information about a patient and any results of clinical trials. It can aid in identifying appropriate clinical trials that are suitable for a patient. Okay, how are genetic tests used? Gene mutations play a role in development of all cancers. In some cases, inherited mutations may play a major role. And while coming into this cancer treatment, now that we have talked about how cancer is prevented, found and diagnosed, let's talk about how cancer is treated. For cancer treatment, it depends on cancer type and stage. We have surgery, radiation, chemotherapy, targeted therapy and palliative treatment. See here, in surgery and radiation, possible side effects may include swelling, skin changes and fatigue. And while coming into chemotherapy, chemotherapy possible side effects, it includes fatigue, nausea, vomiting, hair loss, mouth sores, pain, etc. And we have neoadjuvant and adjuvant treatment. Here we have neoadjuvant, we have chemotherapy, radiation and hormone therapy. And adjuvant, neoadjuvant is given before and adjuvant is given after. Chemotherapy, radiation therapy, hormone therapy, targeted therapy and biological therapy we have. And what is this targeted therapy? Molecularly targeted drugs are precision medicines. Here the tumor tissue is tested and different from standard chemotherapy applied, and some types of targeted therapies, it increase the lifetime of patients. It includes hormone therapy and etc. Thank you.